Welcome to TEMSIS Tips with Todd. Today we're going to talk about how to document appropriately a stroke, CVA, or TIA in the patient care report in TEMSIS. So here we've got a 68-year-old male who's experiencing the signs and symptoms of a stroke and might even be a TIA. So we went ahead and chose stroke CVA for the primary impression, and under the organ system complaint I chose CNS and neuro. When we choose the stroke, a CVA, or a TIA, that sets up a validation in vitals that we need to address later on. And in this case, what we're going to do here is we're going to hit Add Vitals. And I'm going to click into the pulse, and we're going to type in this patient's pulse. Now, here's a little tip for you. Instead of using your mouse to go to the next field, just hit the Tab key. And you can see it skipped right over to the systolic blood pressure. So we're going to put a systolic blood pressure in here, and I'm going to hit Tab again, which takes us to the next data element, and we're going to make this person a little hypertensive. Now I've tabbed over to the SpO2 qualifier, and I know that that was on room air, so I'm going to put the letter A, and it goes ahead and chooses at room air. For responsiveness, I'm going to choose that this patient is alert. We're going to hit the tab again until we get to the blood glucose. And getting the blood glucose is very important and part of the protocol for stroke and TIA. You definitely want to add that to your patient care report. And we're going to say this person's headache is about a 4. And then we're going to tab over to the stroke scale. Using the Cincinnati stroke scale, we're going to look for some arm drift, some slurred speech, and also some facial droop. If we find one finding that's abnormal, then the entire stroke scale is abnormal. And we went ahead and changed the values on that to recognize that. So in this case, this person had some slurred speech and some facial droop. So we're going to choose stroke scale abnormal in one or more findings. We also want to go ahead and choose the GCS on this patient. And we're going to go ahead and choose 15 for him, and it's a legitimate values without interventions, such as intubation or sedation. And we're going to hit Save. And that gets rid of our validations. Now, what did New Hampshire do during the month of April? Did fantastic. And as you can see, there was a fantastic improvement when patients were, when providers chose stroke and TIA impressions. We only left that field blank 8.8% of the time. That's a fantastic difference over what it was last year. So good job, New Hampshire. That's well done. And that's our TEMSIS tip of the day. Thank you.